All right, welcome. Today, we are building what I like to call the ultimate clinical playbook for a disease you are absolutely going to see time and time again: pneumonia. But here's the twist. We're not just going to talk about treatment. Nope. We're focusing on the single most powerful tool we have to stop it dead in its tracks, and that's vaccination. I want to start with just one number: 2.5 million. Just let that number hang in the air for a second.
So what is that number? Well, that's how many people pneumonia kills every single year. It's the world's #1 infectious killer. And look, this isn't just some abstract statistic you memorize for an exam. This is a global health crisis, and you, as future clinicians, are going to be right on the front lines.
But here's the real question, the one that matters most for us today. How many of those deaths, how many of those 2.5 million people could have been saved? How many of these are preventable through vaccination? The answer? A lot. And that's exactly why we're here. We're going to shift our thinking from just treating the disease to actively preventing it. Okay, first things first, let's really get a handle on the sheer scale of this problem, what pneumonia's staggering toll looks like, both around the world and right here in our own backyard.
And let's bring it right home. 340,000. That's the annual death toll in India alone. Think about that. This isn't some far-off problem. This is the reality you're going to face in your clinics and hospitals every single day.
So, just so we're all on the same page, what are we really talking about when we say pneumonia? Well, it's a textbook definition, but it's crucial: an acute infection of the lung tissue itself, the parenchyma. The tiny air sacs, the alveoli, they get filled up with gunk, inflammatory fluid, and that's what we see as that classic consolidation on an X-ray. And of course, that's what makes it so hard for the patient to breathe.
All right, Section 2. Time to meet the bad guys, the key pathogens. You gotta know your enemy, right? Especially the ones we can actually take out with vaccines.
So check this out. This chart breaks down the usual suspects for community-acquired pneumonia. And what just jumps right out at you? Look at the two biggest players we can prevent with a simple shot: Streptococcus pneumonia and influenza. Together, they account for a huge chunk of all cases. These guys, these are our primary targets. So for the rest of this explainer, we're going to laser focus on these two: strep pneumo and the flu virus. Seriously, if you can get a handle on preventing these, you'll be making a massive difference.
Okay, now, for the really cool part, how do these vaccines actually work their magic? It's basically a tale of two totally different immune responses.
So let's drill down on pneumococcus for a second. That's our #1 bacterial baddie. We've got a couple of different vaccines for it, but they work very differently. So how do they actually protect us? And more importantly, why do we use one in some situations and the other in different ones?
Okay, this slide, this is clutch. You absolutely have to understand this. Think of it like this: the conjugate vaccine, PCV13, is the smart vaccine. It's clever. It links the bacteria's sugary coat to a protein, which basically tricks our immune system into launching a full-scale T-cell-dependent response. And what does that mean? It means you get immunologic memory, long-term protection. You even get herd protection. On the other hand, the polysaccharide vaccine, PPSV23, is more basic. It gives you a T-cell independent response. No memory, no herd protection. So what's the big takeaway here? PCV13 is the one that builds the strong, lasting foundation. Okay, enough theory. Let's get practical. How do we actually use this knowledge? This is your clinical playbook for vaccination, from tiny babies all the way to the elderly. All right, for infants, the schedule is pretty straightforward, and there's a good reason we're so aggressive with it. We use the SMART vaccine, PCV13. We start early, at just 6 weeks, then 10, then 14. Those first 3 doses build up the initial defense. But, and this is so important, that booster dose, given around the 1-year mark, that's the one that really locks in the long-term immunologic memory. You can't skip it.
But what happens when our patients aren't babies anymore? Well, for adults, especially our high-risk folks, the game plan completely changes. We have to be a lot more strategic about it.
And this right here is the adult strategy you need to burn into your brain. For anyone 65 and up, you do a 1-2 punch. Step 1, you lead with PCV13. Why? You guessed it, to build that strong, smart, memory-based immune response. Then, at least 8 weeks later, you follow up with PPSV23. The second shot gives broader coverage. It protects against way more strains of the bacteria. And get this, starting with PCV13 actually boosts the effectiveness of the PPSV23 shot later. It's a brilliant strategy. Now, we've talked a lot about pneumococcus, but we absolutely cannot forget about influenza. The annual flu shot is, and I mean this, non-negotiable. Here's why it's so critical for pneumonia prevention. The flu virus doesn't just cause viral pneumonia on its own. It roughs up the lungs, damages the lining, and basically rolls out the welcome mat for a secondary bacterial pneumonia to move in. And who's the most common culprit? Our old friend, S. pneumo. So that flu shot is pulling some serious double duty.
Okay, so we've covered the what, the why, and the how. Now for the most important part, your role in all of this. This is where you, as a clinician, lead the charge in protecting the most vulnerable among us.
These are the people you need to have on your radar, constantly. The elderly, of course. Anyone with chronic conditions like COPD or diabetes. Your immunocompromised patients. People without a spleen. Pregnant women. And yep, that includes us, healthcare workers. We are on this list too. These are the folks who are counting on us to keep them safe.
And hey, if you ever need a reminder of why this is all so important, just look at these numbers. I mean, a 75% reduction in invasive pneumococcal disease from PCV13, that is a massive, massive win for public health. This isn't just some theory from a textbook. This is real-world proof that these vaccines save lives, period.
So I'm going to leave you with one final thought. A clinical pearl that I want you to make your mantra. Every single pneumonia admission is a vaccination opportunity. Think about it. That admission is, in a way, a failure of prevention. It's your job, your responsibility to make sure that when that patient walks out of the hospital, they leave protected. Never, ever miss that chance.